Hello, Dr. Ray.
Hello, Chef Jay. How are you, my friend?
I'm doing great. Thanks for asking. Welcome back to another week of Ingredients for a Better Life. Good to see you, good doctor.
Great to see you again.
So to jump right in, very popular today and recently in the media from the Grammy show and Jada Pinkett Smith and alopecia. What is it, the different types, and how do we address it and how do you fix it from your side of the house? I know for me, pretty limited, knowledge. I know for me, I have the androgenetic alopecia, you'll call it, which is kind of the most common from what I know. But beyond that, I don't really know too much about it, and there's a lot of attention in the media now. So I figure you could kind of clarify as to what it is and the different types.
You got it. Why don't I share a screen? We first have to figure out the type of hair loss that an individual has, Chef Jay, and they come in with a story of hair loss.
Yeah.
So you have to start bifurcating what types of hair loss that you can have. So one of the easiest ways for physicians to separate the types of hair loss, we have what's called acute versus chronic. Okay, acute means it can happen in a short period of time, and we've got a window of say 30 days, right? What can happen in less than 30 days? And chronic would be anything over 30 days, with the majority being months and years. And that's when you started mentioning you had the androgenetic. You realized your hair loss was a miniaturization pattern over months and years. So you fall into the chronic bucket, right? Now, this Jada Smith seemed to have a less than 30-day hair loss issue that happened so quickly that she couldn't create a hairstyle to cover it, right? And that's what happens with some of these hair losses acutely. Now, chronically, Chef Jay, your hairstylist, and this goes out for all the hairstylists that follow your channel, the hairstylist will start cutting short hair styles, right? As the hair thins, more short hairstyles, and you still look okay over those periods of months and years while the hair loss is happening, right? Now, if it happens acutely, there's no hairstyle that you can cut to cover it up, right?
Right.
So as you see on the screen here, we've got two acute patterns of hair loss. So before we bring them into the office, so in our program, as you're well aware of, Jay, unlike the other online medical, quasi-medical programs, we actually have medical doctors, physicians, consultants, hair loss experts. We've got a ton of people for you to speak to and for us to learn about your hair loss, not just clicking a button and telling us what you think your hair loss is. So the first thing comes down to the history of the hair loss. We have to hear what someone's history of hair loss was. So in this case, let's say it's acute, less than 30 days. So when we get into the bucket of acute, there's a couple of different causes. So we say in the environmental causes of acute hair loss, it's a life stress. So what can life stress do in a short amount of time? And this is where the word telogen effluvium comes in as a diagnosis. And then the one, as you mentioned, alopecia areata, okay? Now, within these two here, life stress can cause hair follicles to be ejected from the scalp, right? Now, that's different than your hair follicles miniaturizing and getting smaller over time, right? Now, this is hair loss that happens where you'll see it on the floor, right? This happens overnight and over the course of a few days. Now, the pattern you see telogen effluvium over there, Jay, as the stressors could be, for example, physical or mental. Physical could be a big surgery. Mental could be loss of a loved one, right?
Okay.
Loss of a loved one is mental. A big surgery would be physical. Those would be the life stressors. And then the types of hair loss could be the telogen effluvium. Now, what does that pattern look like? That is diffuse hair loss all over the scalp. So you'll see just really thin hair over the course of 10 to 15 days. Now, if I look at it under the microscope when you come in, we're going to look under the microscope and we're going to see no follicles, empty follicles, not miniaturized hairs, but no follicles. What's happened is the stressor in the body has caused the immune system to overreact and cause that follicle to come out. So
Okay.
telogen.
I was going to ask if there was something excreted or something, causing it, but it's actually from the immune system. That's interesting.
Uh-huh. Yeah. So the body your body's a temple and it reacts to whatever is going on, either life stress inside, physical, or outside, mental. But that life stress can cause the body to react. So
Yep.
telogen effluvium, diffuse hair loss all over, usually about 10, 15 days, and you'll lose about 10,000 hairs, about 1,000 hairs a day. Now, if you did this for 100 days in a row, you wouldn't have a hair left on your head
Sure.
because you have 100,000 hairs. So that gives you an idea of the impact over the course of 10 or 15 days, but it also lets you know that it doesn't continue or you'd lose the rest of them. So that's telogen effluvium, diffuse, scattered hair loss. Now, the other one, alopecia areata, a coin size, a clustered, a coin size little circle of hair loss. It could happen anywhere in the body, non-specific. It could be in the arms, it could be in the chest, it could be in the beard, it can be in the hair. Now, alopecia areata, stress loss in the hair, can be those little circles, and that can be also total hair loss. All of the hair you can lose all of the follicles on the hair. That can happen over the course of 10 or 15 days as well. You could have universal hair loss of the head, the face, the body, all over. Or it could just be these little circles. What's most common are these types of circles or these little scarred areas. And Jada Smith seems to have more of a linear, right? Not a
Okay.
circular, but more of a linear type of scarred hair loss. And from what I understand, over the course of 30 days or so.
Now, is it exclusive of stress, or is there that inherited enzyme activity as well presenting, or is it purely stress?
So we don't know the answer, Jay. Now, I will tell you this, most of the time, nothing the doctor has to do besides pat the patient on the back and ask them to just take it easy, relax, try to remove the stressor. So if it's a lost one, you can grieve and get over the lost one. If it's a physical stress like a surgery, your body will usually recover, and then just make sure you put enough protein in there to grow the hair
Yep.
back. So the body will heal itself. Sometimes if it's a stressor, we can use therapeutic agents, molecules like steroids that'll get in there and decrease the immune response. And if we use it in an injectable or a topical, it's very specific to the area. Sometimes if you've got the hair loss all over the body or something affecting the whole body, you would have to take an oral prednisone or corticosteroid, something to tell the immune response to relax a little bit. It down regulates the body's immune system by working on the enzyme regulators of the body.
And oftentimes, though, they have side effects, and you can't use them long term, right?
Yeah, there's no long-term steroid treatment for this. This is something that the body needs to heal itself, unlike the genetic cause that you and I have. So now bring back the case you mentioned. Jada Smith was the case. So what's obvious to everyone today is the linear scarred alopecia. What was not obvious to most people is an underlying androgenetic hair loss. She has miniaturizations in zones 1, 2, and 3, which is causing recession of her hairline. So most likely they could confuse those two.
Yeah.
So you could treat one of the issues with the injectable corticosteroids, which I think is the line of treatment that they are attempting, and then not really looking at the blood work and evaluating the underlying genetic component. Now, if you treated the underlying genetic component, you could then also concomitantly treat the stress-induced immune alopecia hair loss as well.
Okay. Now, will your hair regrowth topical work for these cases, or is it purely a steroid-based injection?
So absolutely. So our therapy is based on a specialized compounding pharmacy, and that's new to probably a lot of viewers and listeners. But we take individual molecules and then we create a formula based on what the condition that we're treating. So for Jada Smith, for example, we would look at her blood work, we would look at her under the microscope, we would develop a topical solution for her that would be immune regulators, it would be enzyme regulators, it would be hormone regulators, it would be nutritional supplements, it would be whatever is evaluated and discovered in the blood work. So the blood work today is the only way to tell what's going on in the body. It's as if, did you go in and have your doctor look at it, right? Did the doctor see you in the office? Well, those were the old days. You had to be seen in the office. Otherwise, how would you evaluate the patient? Well, today, it's less about seeing you in the office. It's more about, did I see your blood work? Did I look at your enzymes? Did I look at your hormones? Did I look at your nutritional biomarkers? And that's the 9-panel BRC. So some people will come in with blood work, but you need to look at a comprehensive, holistic biomarker approach where you're looking at the nutritional, the genetic, and the hormonal components so that you can understand what's going on inside the body, because all of those factors are, they relate to each other.
That's it dovetails into a good topic that I wanted to go into from a recent consult. Was I was talking to one of your senior people on your pharmacology team, and there was a question that came in. We talked about last week that we all know that 80% of men, whether in the world, whether Mars or on Earth, 80% of men present with the one enzyme that's responsible for this, we'll call it, hair loss or hair. It affects hair loss. It's one enzyme, and then 20% of all men have both these problematic enzymes that go off and start misbehaving and need attention. Otherwise, they're going to do bad things like smother your hair follicle, and it's a problem. So the question was, it is actually, for a lot of people that are taking something prescription based, no matter what the ingredients are, no matter if it's finasteride or some other ingredient, is without a proper diagnosis and someone like yourself to do the lab work and to know exactly which enzyme it is, it can actually be hazardous and dangerous to your hormones or to your hormonal system if you're if you're not getting the proper dosage of the individual drug. It could actually increase your estrogen or something like that, which could be very dangerous. It is negligible of these companies, these big pharma companies, to even give these drugs out without the blood work, because they can be more hazardous than they're helpful, right?
Well, big pharma can't give out medicines. The physicians are the ones that utilize the molecules in their formulas to create some sort of desired outcome. Now, the physicians treating the hair loss today are not endocrinologists, and they're not evaluating the blood work. So the endocrinologist and the urologist are evaluating the blood work, and if they are monitoring the hormones, they are going to get this right. The patient that we had today, as you alluded to, he had a DHT to T ratio 1/2, but he had an estrogen level of 40. So the DHT was 15, the estrogen was 40. The cause was estrogen, not the DHT. If you had treated him with a DHT inhibitor, like the finasteride and the Propitias that are approved by the hair loss physicians in the United States, you would have led to an increase of estrogen and an increase of the hair loss in that individual. That happens in many patients that are treated in the United States. So the United States uses minoxidil's molecule and the finasteride molecule. You've been through the consultation. You know that the minoxidil molecule works on the prostaglandin E receptor, and for the formula to work, it must work on the prostaglandin F receptor. And you understand that the finasteride molecule lasts for 6 hours in a 24-hour day, and you've got to last for 24 hours in a 24-hour day. So you understand how the molecules in your formula not only are more effective, but they're more precise, right? They were more calculated, more thought out about what we wanted to do for you for a period of time. Now I've got one individual that wants to have another child, and he says, what should we do about the molecules? And I said, we can stop the molecules, pause for 2 months. The molecules are out of your system, have your babies come back and restart on the molecule. The
Yep.
reason why we do that, that's the safest way to do anything on earth. So we're the safest, most precise company that treats hair loss in the world. We happen to have 50% of our clients in the United States, continental United States, and 50% are international.
Yep. That's just the point I wanted to hit home there was, it's not just the ingredient, but it's also, the properly diagnosed ingredient in the right amount, prescribed by someone like yourself that's been doing it for a couple of decades. That is, it's not just a certain ingredient magic, off the shelf thing. It's precision based on the individual via the blood work. So, it's good not to give out these just ingredients. These are the drug names, because it's not quite that simple. So I wanted to just get that information out there, that without the blood work, it's a dangerous game that you're playing. You don't want to mess with your hormonal system. I'll tell you that much.
If you're a young person and you're just now getting to understand the world around you, and the way you react to the world around you, if you start messing with someone's hormones and you don't understand what you're doing, you can definitely cause problems that you're not really well equipped to treat. And we already have issues with the anxiety, depression, ADHD. I read a study, 18.1% of young adults have some sort of anxiety and depression. Our studies have correlated with 20% elevated estrogen inside our client base. Our happiest clients are those that we have the opportunity to work on the hormones inside their body and reduce the estradiol inside their body. So from an endocrinology standpoint, not from a dermatology standpoint, and this is more of looking at the hormones, all of the hormones, Chef Jay, and also from the nutritional standpoint, understanding how the nutrients inside food will turn into the molecules inside our bodies. Without understanding that correlation, it's going to be hard to get in there and use a customized, compounded, specialized formula. And this is what we're, training physicians all over, as many as we can, to get them to understand the science behind the transformation, or using the first law of thermodynamics to understand how the molecules work inside a human body, which is called a closed system.
We also have a new TikTok, Stop and Regrow, where we have these short, informative snippets or Instagram reel type of things to kind of get these quick messages out without being overloading people with, because it's a lot of information to absorb. But it's good that we're getting it out there, and that there's a lot of, for myself, and I'll use myself as an example. I was going through some anxiety that was based on high estrogen, which you were able to identify. I was able to get off those anti-anxiety pills and stop with self-medicating with various things. And so it is, from that standpoint, I think there's a lot of other people that are going to start stepping forward when they see the transparency with us, and that it's totally almost normal in society to self-medicate nowadays, but you don't have to anymore. And oftentimes on your program, it's cheaper. I was spending so much money at the dispensary and doing all that stuff, edibles and all that garbage, where Stop and Regrow, $6 a day, you fix the problem and stop just treating a symptom. So
you're right, Jay. I'm glad that we could help you, and I'm glad that you're sharing the message with others. There's going to be a customized supplement, one customized supplement per day that every individual will take. The question will be, will it be a supplement that you pull off of the shelf, or will it be a customized supplement that someone makes for you precisely based on your analysis of your blood work? And that's going to be the biggest choice.
Well, thank you, Dr. Ray. Thank you for your time and what you've done for me, not only me, others. We were able now, with this research and with your program to change our DNA, how it's reacting within our bodies, and we don't have to deal with the negative inheritance that we have, and not only hair loss, but for us to be able to go into our future, live into our hundreds without diabetes, heart disease. It's all related. It's increased immunity, like you mentioned before. It's all part of the big picture. So thank you so much for your work, good doctor, and your time. And always look forward to these chats with you. You keep doing what you're doing there, and I'll get the word out to as many people as I can, and we'll just keep it going. So you have a blessed Easter, and thank you again for joining us today.
You got it. Thank you very much, Chef Jay.
Thanks, Doctor. Take care.